Okay, welcome back to another Coda podcast. I'm Roger Harris, and I am joined again by the wonderful Tori Steve. And Tori is an emergency physician in Johannesburg. I wrongly said she was a critical care specialist. She's a critical care fellow. She asked me to correct that because that's just how lovely she is and honest. In my mind, she's a critical care specialist. But Tori and I had just recorded a previous episode talking a little bit about her job as an emergency physician in South Africa. And I was sort of highlighting the fact that she's really at the front line of trauma in a particularly challenging, resource poor setting. And I always think of her when I think of, the real people that walk the walk in trauma. Tori's one of those people I think of. But in the previous podcast, she touched on a particularly difficult period in her career earlier this year when she was experiencing the third wave of COVID in South Africa. The hospital was chock-a-block full of COVID patients, and in the middle of it, there was some political unrest and riots broke out, and she was seeing 30 gunshot wounds a day for a couple of days. And if that wasn't enough, the hospital started running out of oxygen. And because of the civil unrest, the oxygen supplies were a major problem. So, Tori, thank you for rejoining me, and sorry to remind you of those traumatic experiences. But in that early conversation, you mentioned it was the first time in your career that you really, felt frightened. Is that right?
So living in South Africa, you do get you are at risk, and you do need to be incredibly streetwise, careful. But generally, if you are in your affluent suburb, as I'm fortunate, to live in an affluent suburb, you generally are safe. And it's only sadly when you are at work and you see how the less fortunate are by far, more the victims of crime than you could ever be, that you actually see how severe crime and trauma is in the country. But this time it was quite frightening because it all happened on a weekend that I was actually working in COVID ICU. It was, I think I was looking after over 30 COVID patients in ICU that weekend. So I wasn't focused on what the news was saying. I hadn't even looked on Twitter what was going on. So on the Sunday morning, I got up and I went to work, and I was driving to work at about 5:30 in the morning, when all of a sudden I was on the highway and the highway was closed, and we were diverted off the highway into the middle of Joburg CBD, which is an incredibly unsafe place, which I vaguely know from my time working in EMS. And I was diverted into a neighborhood that I knew from EMS was particularly dangerous. In fact, EMS won't go into that area without a police escort. And here I was driving my car by myself, and I'm thinking, because the police had directed us off the highway, but they hadn't directed us as to where we should go. There was just like you're on your own type thing. So, and I couldn't use my GPS because it would have wanted to take me straight back on the highway, which was closed. And I found my way through that area. I was luckily fine. Got back onto the highway, and it had actually been that the highway was closed because the riots had actually broken out in that dangerous area that I was in. And I just carried on, arrived, managed my COVID patients. And then I realized that riots had broken out, and that, there was just trauma, looting, various things were just breaking out in different areas. Went to work on the Monday, and the gunshots started to come through. After work, I decided to go to a shopping mall in my area to try and get some food. I figured that I didn't want to be at shopping malls for the next week or so, because they were being targeted. So I just decided to get my shopping done. And while I was in the queue, the security started panicking because they thought that rioters were coming to loot the shop that I was in. So luckily it was just a false alarm, but it was pretty terrifying, as this was an area that I felt completely safe in. I'd grown up in. So that felt quite personal. And then after work, I got a call to say that Afrox had not delivered oxygen yet because they couldn't get to my hospital without an armed escort. And the piped oxygen supplies were starting to run low in the hospital. And, you know, in South Africa, we're used to having limited resources. And I have heard of oxygen running out or running low in other African countries. I had never thought that that could ever happen to us. So it really just felt like we were in the twilight zone. And it was actually after curfew, because there was a curfew in place, and I knew that my hospital was needing help. And as the emergency physician, I probably knew the disaster plan for my hospital better than anyone else. So I said to my husband, I'm going, I have to get to the hospital. I'm just worried that the truck isn't going to arrive in time. We're going to have to start distributing oxygen cylinders to the various wards. There were 120 COVID patients in the hospital, all drawing oxygen from the pipe supply. I have to get there. And he said to me, you can't go. You don't realize it's after curfew and there's just violence breaking out everywhere. And so I was like, I have to go. I can't sit here in my house thinking of what my juniors are going through. So he was like, you're an absolute nutcase, but I'm coming with you. So we got into my car and drove there, and I managed to get a flat tire on the way. So that was great. And thank goodness my husband was with me. And he's non-medical. So, you know, for him, it was an experience. And yeah, arrived at my ED. The gunshots had started helping manage those patients while my husband stood in the reception area waiting for me. And we were about to start distributing oxygen cylinders when the Afrox truck arrived to deliver oxygen. And I have never been so happy to see a truck before. And they started to fill up our supplies. They actually only gave us, 10 tons. I can't remember the exact number, but it was enough to give us 10%. So we ran off 10% for the rest of the night until they could come back the next day, because they had to ration us because they needed to supply multiple hospitals, both private and state. So we all got a small amount just to tide us over until the next day. But, you know, the pressures were running low. And as I said in the previous podcast, the anaesthetists switched to cylinders and were managing gunshot abdomen laparotomies off cylinders and lots of ketamine because, yeah, it was just unsafe to continue with the piped oxygen, and the anesthetic machines just were alarming. So, yeah, fortunately, that was very short-lived, but it felt like the Twilight Zone. It felt like I was living someone else's reality, because not even in my own country would I ever have expected to have gone through that. It really did feel like a war. But fortunately, the violence was brought under control within a few days. So we had to just manage for a few days, managing loads of trauma patients and COVID patients at the same time. But we got through it.
Yeah, wow. Okay, I don't know where to begin. I'm a little surprised that you haven't taught your husband how to put a chest drain in, but it could be. Sounds, you know, I would expect more of you in that situation. But I know we're laughing about it now because it's obviously 5-6 months ago, but certainly at the time it you know, sounds horrifically traumatic. And I guess many of us in in our specialties have been through traumas, not many of them that would be as intense as that, the obligation that you described, which is, I guess that's the Tori, Steve, and I know that was fronting up to her hospital because it was her job. And that's the best bit of healthcare, right? That was on display in that action. But, driving through the streets at night with riots on would be absolutely terrifying. And how do you sort of process that? Share with me a little bit about what you've done since the event.
I still feel that we are traumatized by what we went through. I actually started seeing a psychologist after the second wave, and that has been an amazing resource just to process just the lockdown and the COVID waves, the lack of resources, the stress, looking after my own staff as well as the patients. And, to ensure that they're looking after the patients, you have to look after them. So that's an enormous amount of responsibility. So that has been a great thing to get me through. I guess we just have carried on in many ways. In Gauteng, in my province, the riots were bad, but not as bad as KwaZulu-Natal. And I've spoken to some of my colleagues in KwaZulu-Natal as to what they went through. So, for example, in Pietermaritzburg, which is a kind of like a small city, there was actually only one supermarket that was left standing. So they had to, after work, after managing all these trauma patients, they had to go stand in a queue for like 4 hours for food for their families. So I didn't have to go through that. But that was crazy. So the shops, and there were police on scene to handle, the queues to make sure that there wasn't further riots, but they allowed all the healthcare workers to actually go into the store first. But so I think that is another level that they went through. But still, it was pretty stressful.
Such valuable advice in terms of, obviously working with your team, but also seeking some, your own personal help, and professional help in terms of debriefing and processing a lot of that things. How about your poor husband? I mean, you haven't even been married 2 years at that point. You're still together,
Yes.
Right? I should have asked that earlier. God, I'm surprised he didn't pack his bags after that.
Yeah, he's pretty resilient. But I think he's been an amazing support to me as well. He works in the corporate space, so he works in a very different type of setting to myself, a lot more sheltered, but he experiences it via me secondhand.
One of the things that always strikes me with our FOMED friends, particularly those of you, I guess, in the sort of bad EM community, and that is this real passion for what you do. And I don't know, how do you sort of sustain that, particularly after what you've just been through? How do you sort of then not just process that, but how do you not even just keep going? How do you sort of keep going with passion?
I've realized, after many years of being a doctor, my passion was constant as a junior. And it was only over the last couple of years that I found my passion ebb and flow. And a lot of it has got to do with exhaustion, frustration with the lack of resources, sometimes getting bogged down in administration, which can sometimes preoccupy you for most of your job. So what I've done is I make sure that I stay clinical, because that's where I find that my passion is reignited. So I did a fellowship in critical care. So I still need to write exams, but I found that very useful. And I just make sure, particularly on busy days, that I stay out of my office and I stay away from my administration duties and stay in recess or stay in the clinical areas, looking after patients, helping my juniors. Because if I spend too much time focusing on administration, I really get frustrated and bored. So that's something that has helped. And I think just also, being kind to yourself and understanding that the system is really just not good enough for our patients. And sometimes as a junior, I used to measure myself by looking at the outcome of my patients. And if the outcome was poor, I would beat myself, like, mentally, not realizing that the system had a huge amount to play. The system is really just not good enough for our patients. And sometimes as a junior, I used to measure myself by looking at the outcome of my patients. And if the outcome was poor, I would beat myself, like, mentally, not realizing that the system had a huge amount to play. So I think making that separate in my head has really helped, just to help me understand, okay, I've done my best. That's all I can really do in the system that I work in. And just also making sure that my juniors know that as well, because sometimes they may not come for a debrief or not ask for a debrief. And I have to just kind of be quite sensitive to how they're feeling, just to make sure that they're not internalizing too much of this, and just to make sure that they're getting the help that they need. And I think during the different waves, I did use different skills to try and help me get through it. I think the first wave was quite nerve-wracking because we watched Italy and New York be overwhelmed. And that was nerve-wracking because these are high-income countries, some of the best care in the world, and they were struggling. They were overwhelmed. So we knew that it was going to be very, very hard on us. But during the first wave, I just made sure that I exercised as much as possible. I would wake up at 5 a.m. and just make sure I exercised, because after work, you just finished, you're too exhausted. So I would make sure that I had that done. And during the second wave, I used the Calm app and did a lot of meditation to get me through that wave. And the third wave, I felt like meditation was actually too difficult. I was too exhausted and overwhelmed. So I just listened to music and created a playlist on Spotify that different emergency consultants and registrars across the whole country contributed songs to. So it was like our survival playlist. Yeah, and that was the only thing. I used to drive to work listening to that playlist, and that's helped me get through the third wave as well.
I think Liz Crow would be proud of you sort of demonstrating some of those techniques, and particularly the way you sort of chronologically evolved your self-care during that time. And I thank you for your honesty about also saying, you got some professional help, like many of us have done through our careers, to help sort of see you through those really tough times. You are truly inspiring. I love talking to doctors like you that really put things in perspective. I love your passion for your patients, and we just have to work out a way to get you a job in Sydney now, so you can retire to our gentrified ways here. But I really thank you for your enormous service to what you do for your community.
Thank you to you and to Chris and to Ollie, because one of the things that has helped me maintain my passion has been the FOMED community. I discovered SMAC on Twitter in 2013 during the first SMAC, and I watched the first SMAC on Twitter through tweets, and then I decided I have to get to Australia for SMAC Gold. And it was fantastic. I met so many people who are still my friends today, who had the same passion for medicine that I did. I learned so much. And with every subsequent SMAC, it's been a fantastic way to have a reunion. And we still have a reunion to come at CODA. Exactly. Now that vaccination is up and lockdowns are now being limited. So I really look forward to that. And it'll be wonderful just to see everybody again. I'm so grateful for the FOMED community. It has got me through difficult times in the past. And yeah, I've learned a lot.